Today we're talking about a new damage awareness campaign, a multi-vehicle marketing initiative to help raise awareness of the risks of damaged soft surfaces in healthcare. The focused audience of this campaign is frontline healthcare stakeholders and infection control professionals. I'm joined by Barb Catt in Infection Control at Sunnybrook Health Sciences to discuss this topic in more detail. Barb, thank you for joining me today.
You're welcome. It's my pleasure.
Thank you. And so I want to ask a series of questions to help the audience here understand a bit about how you've incorporated a damage awareness program. First of all, in your experience, how do mattresses and other soft surfaces get damaged in healthcare?
These surfaces actually get damaged certainly over a period of time. For example, our emergency department really went through, or they were having a lot of issues with the mattresses being torn because of its overuse or utilization. So say, for example, patients are gone, then what happens is they're cleaned with high-level disinfectants, and any of those products, too, can wear and tear even and damage the actual surfaces, especially multiple uses. And certainly, even just with staff, for example, using their needles, they need to put it someplace, and they'll poke holes in the mattresses, and certain devices might accidentally rip and tear these mattresses. So this is what we were finding, how a lot of them were getting damaged.
Yeah, okay. And Barb, did you often see a lot of damage in your day-to-day practice in the facility? Was it something that was in nature?
I myself have seen quite a few damaged mattresses, and this is where actually in the beginning or in the early days we would tell them that they would have to be discarded or thrown out. And of course, we always look for, in particular, damages that had, and it's funny because I think of the waterproof pink tape that would be multiply used on many of the mattresses and surfaces that had been damaged. And you can see actual gummed up areas where, it's dirt, but it's actually just gummy areas just from the overuse, and it should be actually discarded when it hasn't been in the past. So, yeah, I have seen them, and, certainly visually it's lacking that cleanliness is what I think of.
Absolutely. And why is this a safety concern for patients and staff?
Well, when these surfaces, for example, the mattresses, are ripped or torn, they cannot be properly disinfected. So in other words, you've got this irregular tear in a mattress or on that surface, and what happens is the organisms can multiply and get into that surface because you've got an area that really is a great area for organisms to multiply. It's a nice area where you've got a little bit of moisture there. You've got, for example, it's dark. It's over a period of time, and the contact time or even any of the cleaning agents that are used cannot properly go into those surfaces.
Yeah, absolutely. So with the recent launch of the damage awareness campaign and the availability of the damage awareness poster, what do you think are the benefits of this type of initiative and awareness activities?
This initiative is spectacular in the sense that we had a recent safety day, and during this safety day it was brought to my attention that our staff really did not have a clear awareness of the importance of having intact mattresses or having that awareness of how important intact surfaces are, especially with cleaning and disinfecting between all our patients. However, in saying that, when I had the posters up and presented in multiple areas, the staff, and we've had this product in our hospital for over 3 years now, and the staff were unaware that we even had the product in the house, let alone having such a product made available to them in order to patch or do the work themselves. And our prime group of individuals that would be looking at these, of course, were our environmental services staff. So this became really apparent during this day that they were not aware of this rollout or this product being available.
Yeah. And once you had your safety day and you were starting to raise awareness and were putting the poster up in the facility, where did you find the best place to put up the poster to encourage that awareness and communication?
The best place we felt was with the frontline workers that were actually the ones that would be looking at or cleaning the mattresses or these surfaces. And therefore, we felt it was best with our environmental service staff. So we had the posters being placed inside their closets. So as a reminder, or when they open the door, it's right in front of them. So visually, you have that first eye looking at the damage awareness poster. And it really is a great poster to just remind them that it is important and that, they too have this really important role in patient safety.
Yeah. And Barb, any final points or comments or feedback around the initiative and the empowerment of environmental service and other frontline staff in patient safety?
Well, in follow-up, I know that this awareness has brought to the head how important it is for patient safety to have these intact mattresses. But also what was important is being able to empower a group of individuals that really, take pride in their work. And this has given them even that step higher, that they are really actively being engaged in patient safety. So they're empowered to repair the mattresses, and they don't have to wait around for a supervisor, for their manager or anyone else, or the manager of the unit. They can just go ahead and do these things on their own, which is great.
Thank you. Thank you, Barb, for your time.
Oh, you're welcome. My pleasure.
Please visit www.damageawareness.com for more details and to request your free copies of this poster for your facility. Thank you.